RSV cases are on the rise in East Tennessee. East Tennessee Children's Hospital has seen 266 cases of the respiratory disease since October. Almost 100 of those came within just the last week. RSV is similar to a common cold in adults, but more serious in young children, especially if they're under the age of 2. 10 News reporter Amelia Young spoke with a pediatrician about symptoms to look for in infants and when to head to the hospital.
Well, not all cases of RSV in infants require a trip to the hospital, but cases could be more severe in infants less than 12 months old, those born premature, or those with underlying problems like asthma or lung disease. Pediatricians with Children's Hospital say severe signs to look out for include a thick nasal discharge, dehydration where their mouth, nose, or eyes are dry and sunken in, and they have a hard time taking in water. A third sign is having trouble breathing or breathing rapidly.
You can see them pulling in the neck. You can see their chest muscles pulling to breathe. You can see their nose flaring, trying to get oxygen into their lungs. If you see any of those signs, that's concerning. They would need to be seen in the emergency room. And then
if you see these signs, pediatricians say to take your infant to the hospital. There are no antibiotics to treat RSV. Hospitals have the ability to provide supportive care and make sure symptoms don't worsen. The course of severe symptoms can last for 7 to 10 days, but a cough or respiratory symptom can linger for up to 3 weeks.
So it can be very trying for the child and for the families, and very difficult illness. And so we try to prevent it as much as possible. Every year, is different. Some years will be a little bit milder, where we won't have as many cases.
And to prevent your child from being infected, pediatricians recommend staying home if you can during this peak season. And if you can't and you and your child have to go out, they recommend keeping them covered up so people cannot touch them. And lastly, good hygiene by washing your hands and making sure younger children around your child, like siblings, are doing the same. Back to you.